Where Mayor Levar, Stoney and the Richmond Health Director are updating us on the coronavirus.
For the spread of this COVID-19, the coronavirus. Residents of all ages have stayed home, prioritizing the health and safety of the elderly and those with compromised immune systems. Local businesses have selflessly abided by state and local recommendations for reduced capacity. And I went in today knowing that our community was and still is united in the effort to flatten this curve, of infections. And I want to begin by saying I'm very, very proud of this city. We still have a long ways to go. This is just the beginning. And unfortunately, this is a new normal for us. We are in uncharted territory. And to shorten the time in which we have to experience this moment, it takes each and every one, no matter what age, what gender, what race, to combat this virus. We all have a role to play. Every generation has a role to play. So if you can be just as selfless as the small business owners who've closed their doors, who suspended their livelihood, if they can do that, then each and every one of us who live in this city can play our role as well. As of today, 4 individuals who reside in the city of Richmond have tested positive for COVID-19. 2 are men in their 20s, and 2 are men in their 30s. All 4 are at home in self-isolation, and none of them have been hospitalized. All 4 of them have recently traveled outside of the Commonwealth of Virginia. 3 of them were in a group. Epidemiological research is ongoing, and so there'll be further information provided by the health department moving forward. And with the knowledge of these cases within the city limits, now is the time to increase our diligence to keep each other accountable. We have to be vigilant, personally vigilant, in this combat versus COVID-19. So I will continue to urge each and every person to stay home if you can. My team is working on the best way to support those who can't stay home. Right now, the city of Richmond is closed to the remainder of the week and likely will be closed for the remainder of the month. We also are exploring best practices to serve the elderly, loan programs for the small businesses who are currently closed their doors, and obviously we're exploring child care options for those who have to go to work, who are essential for the operation of our community. Also, I want to take a moment to tell the public as well that we will enforce the order provided by Governor Northam yesterday evening. It says that no longer that we can be in rooms or facilities with more than 10 people at a time, small businesses, restaurants, you name it. We will join the health department and enforce that order. We are obviously working nonstop around the clock. Although our doors are closed right now as a city, we are working diligently to ensure that we keep each and every resident in this city safe. And we ask that our families out there, that they stay safe as well, safe and healthy. With that, I'd like to invite Dr. Danny Avula, the Director of Richmond City's Health District, Richmond and Henrico's Health District, to provide a briefing on the current situation. Dr. Avula.
Thank you, Mayor Stoney. As Mayor Stoney said, we have our first cases in the city of Richmond. 4 cases, 3 of whom were a part of a group trip and were actually part of a contact investigation. So a few days ago, we announced a positive case for a Henrico County resident who had traveled as part of a group down to North Carolina. These 3 other members were part of our contact investigation. So to some degree, this is what we expect the work of the health department to yield. When we identify a case and we go and we interview potential contacts and test anybody who's symptomatic, we expect to find spread to other people. So in some ways, this is what the point of contact investigations is, to identify those other cases. Thankfully, because they were associated with that first case that was diagnosed a little bit earlier, they were instructed to self-isolate, and epidemiologic investigation is ongoing. We just confirmed these cases just a few hours ago, and so our epidemiologists and research team are making contact, are interviewing, are determining what other potential contacts that they've had, and I expect that will yield other people that need to be quarantined and potentially tested if they develop symptoms. It is just a reminder, we've been talking about the inevitability of this for several days and weeks now. That each case that we confirm, I hope, is a reminder to our general public about the seriousness of this and just how widespread this is in our community. And so anybody who's on the fence about should I go out or should I go to work, I know that this is causing a lot of economic challenge for so many of our residents who need to show up to work. But as the mayor said, these are unprecedented times, right? And we all have to make decisions not just for our own welfare, but for that of all of our entire community. So I really would ask that people abide by the advisories to stay home, to shelter in place, to work remotely if you're able, to avoid crowds and gatherings of more than 10, and to do everything you can to limit the spread of this disease.
We have time for a few questions.
Gabrielle? I have a question for the mayor, actually, too. I know you just mentioned that as the city, you all are going to be enforcing what was brought up last night by the governor. Can you explain a little bit more about that? And I guess if the police were the ones who asked him to do that?
It would definitely be in a partnership with the health district, so I'm going to let Dr. Avula lay out what their role is, and then we'll follow through.
So yesterday evening, the governor and the state health commissioner released public health emergency orders. So public health department staff, our food inspectors who are typically permitting restaurants, have been instructed to visit, to do surveillance in the community. And if there are restaurants that are convening more than 10 people at a time, they will be instructed to stop, and with the potential consequence of having their permit pulled, and law enforcement may be brought in to support that emergency order.
The city has come to depend on independent restaurants by food tax. We're a culture-based city. What's your message for employees, for the owners, for everybody else involved in the actual economics of this?
First, I want to say thank you to the restaurant owners and small business owners in the city, because we have never got to the level where we had to mandate closure of any restaurant. Many of these restaurants voluntarily closed, not only just to protect their employees and their staff, but also protect the community as well. So my first is thank you. As stated last week, we are going to provide a tax amnesty to those owners, and also no fees and fines on any tardy taxes. What we are working with now is how we go about creating a microloan program for those small businesses as well, so they can have some relief during the recovery. For our workers who have worked in the restaurant industry, who have been the backbone of this economy, I would say that I've had conversations with Senator Warner at the federal level, because not only do we need emergency unemployment for some of these workers, as I think people don't understand that 27% of workers in the United States of America actually show up on a payroll. And so there's universally, we need emergency unemployment benefits, but also beyond that, the ability for those businesses to meet their mortgages or be able to pay the rent. So we need to relax some of the current restrictions that banks provide on something like this. We need forbearance for those business owners as well. I'm hearing $1 trillion package coming out of the federal government. We need something today. We need something today. And we all got to play our part, local government, state government, and the federal government. But I tell you this, if the federal government, Congress, and the president can get together and approve a $1 trillion package, it's going to save a lot of communities like Richmond as we think about the recovery.
Mayor Stoney, we get a lot of questions asked about daycares across the city. Have you all reached out to any of them, working on a plan to make sure that these kids remain safe inside those daycares?
Yeah, we are working on plans on daycare as well, particularly for those employees who may have to go and stock the grocery stores, or their healthcare providers as well, or even those who are a part of our first responder team too. So we're exploring our options there. Nothing concrete to announce yet, but obviously child care is very, very important in this time where the continuity of government, the continuity of our society must continue.
Mark?
Did I understand correctly that 3 of the cases were linked to the Henrico County case, or all 4?
3 of them were.
3 of them. Do you have any idea where it was spread? Was it in the workplace? Was it at a community center?
Yeah, these individuals went on a group trip together down to North Carolina. They were, I don't know details about what they were traveling for, but they went together. They came back together on March 9th. A couple days after that, the first case developed symptoms, was tested, came back with a positive diagnosis about 3 days ago. And then that initiated the contact investigation that led to these 3 other cases.
Can you talk about hotels in the city? Are they being shut down at all, or what's the protocol for that?
We're not currently shutting down hotels at all. I know that hotel owners have taken a lot of their own precautions to ramp up environmental cleaning, but I don't have a great answer about if they're taking any other interventions in place right now.
So is it
Last question, Roberto.
3 cases in the city proper, or 4?
4 cases, 3 that were associated with that group trip. The 4th case is a man in his 30s who traveled up to New York and had a known contact with a positive case up in New York. Came back because he was notified fairly quickly after the New York case. He had self-isolated, and so I think we're in pretty good shape on that investigation. But our epidemiologists are continuing to work on that.
Dr. Avula, I have a question, one more just for the testing sites here in Central Virginia.
Yeah.
What's the status on that?
Yeah, so yesterday, Bon Secours announced that it is going to start to move to 4 or 5 regional sites where they will do COVID-19 only testing. I don't know a date for when they will stand that up, but hopefully in the next few days that will create a lot of opportunities for COVID-19 testing. I've been in contact with a number of clinicians who have started doing their own testing. They're large primary care practices, some smaller offices that are starting to do it. As test kits become more available, we're seeing more and more testing. In fact, all 4 of the, two of the most recent cases were done through LabCorp testing. So the fact that they have come through non-state lab is evidence to me that there's actually more testing happening out in the community. Today, the health department will actually be launching its first pop-up testing site. We're doing that currently right now. We're registering patients who are calling 205-3501, which is the regional call center for COVID-19 questions. There's a screening protocol in place so that patients who may have had a contact or may have symptoms are being registered for an appointment, and then we'll do an appointment-only testing site this afternoon. It's the first time that we're doing something like this. Our hope is that we can work out the kinks and then start to replicate this around the region because there clearly is a need for more and more testing at the community level.
Where is that going to be, the pop-up testing?
We're not announcing the location until closer to the start time.
Just the website, Dr.
Yeah, richmondgov.com/COVID-19 for up-to-date information from the city on the health crisis in the city. And what's the website for VDH?
It's vdh.virginia.gov/coronavirus. vdh.virginia.gov/coronavirus. And again, that phone number for the Central Region Call Center, 804-205-3501.
Thanks very much, guys. Appreciate you coming.
Thank you, guys.